كلا إن الإنسان ليطغى أن رآه استغنى إن إلى ربك الرجعى صدق الله العظيم. إلهام كريم कहीं बख्शीश की घटा है ये दिल का नगर है कि मदीने की फिजा है इल्हाम की रिमझिम ऐ गुंबद खजरा के मदी मदद कर ऐ गुंबद खजरा की मकी मेरी मदद कर या फिर ये बता कौन मेरा तेरे सिवा है या फिर ये बता कौन मेरा तेरे सिवा है इल्हाम कहीं बख्शीश की घटा है ये दिल का नगर है कि मदीने की फिजा है।
Now I would like to ask Dr. Jeny that she is going to tell us about substance use awareness in academia, responding to emerging drug use trends among students. Let me introduce Dr. Jeny first. I will give a very short introduction of yours. Obviously, you are a book in itself. So let me tell about yourself. Dr. Jeny is a clinical psychologist and managing director of Psychic Counseling and Health Support Services, a 3-brand psychological clinic in the Philippines. She is a forensic psychologist and an international certified addiction professional. ICAP, she has obviously done. Internationally certified marriage and family counselor. She is author of multiple books. She has conducted different researches, and she has completed her PhD in psychology and master's in guidance and counseling and a bachelor's in psychology. Currently, she is working as FBA Drug Advisory Program and UTC 21 Trauma Informed Care, Softness and Strength Women-Centered Clinical Center workshop expert. She is currently pursuing an expert diploma in clinical psychology through Whitcomb International University in Madrid. So it's all over to you, Dr. Jeny. I'm sorry if I have omitted anything.
Thank you very much for welcoming me and for that introduction. I'm very honored and privileged to be with you today. So good afternoon here in the Philippines. Good morning and good evening for those who are watching us through the web. And thank you very much for the invitation of the administrators, faculty members, and students of Government College Women University, specifically of the Department of Psychology of your university, together and in coordination with the administrators of New Life Rehab Center, and of course, the one who invited me, my friend and my colleague in the addiction profession, Sir Muhammad Aslam, who is also the president of Jinnah Foundation and Youth Forum in Sialkot, Pakistan. So good afternoon and good morning. And I am very much excited to share with you this exchange of ideas. I'm here from the Philippines, and as well, no, regardless of country we are in, we are faced with the most challenging situation now that our students are encountering, our youth is encountering when it comes to the problem of addiction. So I have a very limited time to you to discuss everything about the demands and the trending issues of drug addiction in the field of academia. I am working both in the both setting of clinical and education. I am also a professor in the academic institution, and we are also confronted here in the Philippines with the same problem as you encountered also problems with the students with regards to the use and misuse of different addictions in our both countries. So let me share my slide. Okay, so my topic, okay. My topic is about substance use awareness in academia and how to respond to emerging drug use trends among students. So let me share with you some of the facts that I've gathered while I am doing this presentations. So let us talk about the epidemiology of student substance use. So there are global estimates of 13% of young people report recent illicit drug use. This was recently conducted by the UNODC during 2024, and cannabis remains the most used substance among students worldwide. And these are high grade marijuana or high grade cannabis that are mostly being confiscated all over the world. No, there are sharp rise in non-medical use of prescription stimulants that is according to the study being made by modafinil and Adderall. And study in the Southeast Asia, including my country, Philippines is included in the Southeast Asia, found out that 9 to 12% of student reports polydrug use during examinations. Okay, and what are the neurobiological implications of adolescent substance use? So according to the study being made, the prefrontal cortex of the brain, which is still developing until mid-20s, there is an increased vulnerability to engage in drug-taking activities. And the dopaminergic dysregulation underlies reward-seeking and risk-taking. So if there is an early exposure, there is also an increased risk of later substance use disorders by 2 to 4 times. There will be an impaired working memory, inhibiting control and decision making. These are the most common outcomes of continuous drug use. Now, what are the academic pressures and drug misuse that are being seen, no, in the academic institution wherein our students become a victim of this drug misuse? First, there are high achiever profiles show that higher stimulant is used for performance enhancement, meaning to say that those students who have this high achiever profile shows an indication of higher stimulant misuse. And this studied drugs, we call it the stimulants that are taken to increase cognitive performance, such as focus and memory. Examples of this are Adderall, Vyvanse, nootropics, and Ritalin. Causes sleep deprivation, cardiovascular risk, and dependency. Most of the time, students are being pressured to pass their examination. That is why the use of these stimulants help them to cope with the demands of challenges and pressures in the academic institutions. So there is a stress coping mismatch that suggests that students with poor coping skills are 3 times more likely to have this self-medication. And academic burnout predicts higher nicotine, caffeine, and polysubstance use. In the Philippines, in my country, the most abused drug is the nicotine use. This nicotine use becomes so rampant that every adolescent and even a younger age uses nicotine, and they really use it to release or to cover with the academic burnout. Now, what is the correlation of digital access and online drug markets? There are pharmaceuticals that wherein students, young ones, can automatically purchase prescription drugs, and they remain as one of the most abused drugs nowadays. So there is an expansion of online pharmacies without prescriptions. So this is also very rampant here in the Philippines. I don't know in Pakistan. Now, social media platforms used for selling vaping products, and THC cartridges. Now, social media really influenced the youth nowadays. Most of the trends, most of the fads became so become so famous that even the selling of vaping is really spreading. So vaping in youth nowadays are the most preferred kind of nicotine use among students. And there is an increased exposure leads to normalization of drug use among peer groups. You see, peer influence remain as the one indicators of how the gateway drugs came, and it becomes a fad to every youth that whenever they see somebody who uses drugs, they can easily access the use of drugs to every students. Most specifically, those students who have also household problems. In the Philippines, since we belong to a very poor country, we are a third world country. So peer influence and poverty became the two factors that influence every Filipino young people to engage in the selling and in the use of different drugs, prohibited drugs specifically. Now, what are the protective factors identified in research? According to research being done, strong parental monitoring reduces risk by 40 to 60%. Meaning to say, if there is a strong parental support, and if there is a strong support system in the family, the risk of engaging in a risky behavior such as drug taking among the youth or among the students can be reduced to 40 to 60%. But the problem is, I know that you will agree with me, whenever there are problematic household and what we call as a pathological family structure, there is a high probability that the youth may engage into different risky behaviors such as drug taking. They might neglect their study, and there is a high rate also of um, um, engaging in early labor market. And most of the time, this pathological family creates a what we call household abuse. And household abuse becomes one of the most problematic factor that leads our adolescents to engage in different drug taking activity. Now, high school connectedness is one of the stronger predictors of resilience. In a study I made during 2023, that study pertains to the most happiest moments when our students engage in a strong peer connection. And according to them, high school life is one of the most happiest moments of their schooling. So it depends also to the different peers that they engage to. As I've said before, peer influence remains as the most number one predictor of risk-taking behavior. Now, students with emotional regulation skills show lowest incidence of misuse. This has something to do with psychological aspect of individual. When a person, a student has this emotion, how to develop, they know how to develop emotional regulation skills, there is a greater chance that they will not engage in drug taking activity. Not unlike those who have this problem with emotional dysregulation, meaning to say they cannot process any kind of stress, or they have no ability to effectively manage their stressors. Therefore, they have the most high incidence of engaging in the misuse of drugs. Now, psychoeducation programs reduce onset rates by 20 to 30% when delivered consistently. In fact, psychoeducation and promoting self-awareness, promoting education about the addiction science and what are the risk factors, what are the protective factors, what are the things to be considered in order for an individual to develop emotional skills so that they will not engage in risk-taking activity. One of the most risk-taking activity that I observe among youth is too much partying. You see, Philippines is, most of us are Christians, not unlike in your country. You are very religious in terms of your rituals as Muslim country. But in the Philippines, the youth has so many things to do. They enjoy life, they enjoyed partying, and most of the time, they allow themselves to really enjoy life. And some of the parents are allowing their children to really enjoy parties. And being in a reputable institution and university that will help them to be educated about the moral values of keeping the family intact and restoring their values, and at the same time, giving them enough education, specifically psychoeducation on how to say no, just say no when you are being given certain substances is a very good way in order to not to engage in a more risky behavior. Now, what is the role of psychoeducation? And this is one of the best, actually one of the best method that we use, I use as a clinician, as a clinical psychologist to really promote drug-free nation and drug-free community. I have 3 clinics, and all of those clinics are performing a what we call psychoeducation as a form of psychotherapy, because psychoeducation is one of the best psychotherapy. For almost 15 years in practice, I've given this adolescents, students, pamphlets, brochures, and every now and then I conduct talks and webinars and seminars all over the country to provide them with a very vital information about drug awareness and the use of drugs that can really affect their whole well-being. So according to World Health Organization on 2023, that review suggests that psychoeducation reduces risk behaviors and increases help seeking. And cognitive behavioral therapy psychoeducation, which is still the most widely used and evidence-based technique and therapy that can be used to improve insight and reduces impulsivity, remains one of the best technique when we're dealing with risky behavior among the youth, and specifically on how to cognitively reframe and restructure those cognitive distortions that involves drug taking activity. Now, there are effective programs that include normative feedback and myth debunking approaches that can really help every student, and in order for them to really understand what is drug awareness and drug prevention. It's peer-led psychoeducation also shows higher engagement in university settings. Now, what are the core components of research-grounded psychoeducation? The research-grounded psychoeducation, when it is being given in a proper way, can really give the students the awareness of neuroscience of addiction and reward pathways. And this research-grounded psychoeducation can also give students a specific therapeutic intervention that can challenge their cognitive distortions related to substance use. And also, there will be risk appraisal training included in the research-grounded education. The risk appraisal training and decision-making frameworks can be done when it is being implemented in the university setting. Now, it can also reduce stress, and it can introduce interventions. And some of these interventions that can be used can be of mindfulness relaxation and behavioral activation. Now, what are the models of prevention in academic institutions? I can suggest this 4 models of prevention when we are drafting, or we are going to draft a particular psychoeducation that can be adopted in the different university. The first one is a universal prevention, and that is by promoting campus-wide education and awareness campaigns. Therefore, having this first International Youth Convention in your country, in Pakistan, is a really great measure. This is a really great opportunity for the students to be engaged in a forum and in a meeting where they can explore and they can be educated on how to develop and how to say no and set boundaries to say no with regards to prevention and to promote awareness in the use of drugs. Number two, the second one is a selective prevention targeting at-risk populations, most specifically those students who are developing high risk or they are being referred for having risky behavior, or more than anything else, they are also engaging in a severe use and misuse of different drugs. Thirdly, the indicated preventions, this implementation of psychoeducation in the academic institution will tell administrators of those students showing early signs of problematic use. So this could be a good gauge on how to detect those students who are at risk and who shows problematic use of different substances, regardless of any substances, and automatically the administrators and faculty members can automatically give an intervention or refer to an agency such as rehabilitation in order for the students to be given an early intervention. And fourthly, the multi-tiered system of support, or MTSS, is increasingly used in Asian university. Like in the case of the Philippines, we use this, the multi-tiered system of support, wherein the community, the household, the school community, the other agencies are in one, or totally support of the psychoeducation program in promoting drug awareness and early intervention among youth and among students. Now, what could be the role of faculty, of administrators, since we will adopt the psychoeducation and multi-tiered support for the students who are at risk? First, early identification through behavioral indicators. There are some cases wherein the manifestations of severe drug use can already be seen in young children, in young adolescents. And through behavioral manifestations, this early identification can be automatically be referred to concerning agencies. And of course, if there are referral, it must be an evidence-based referral protocols to psychological services. In the mild and moderate cases, the students in the universities are being referred to the discipline office, and afterwards they are being referred for intervention, specifically for counselors and psychologists who are in place in the universities. And in this way, we can be able to reduce stigma, because the number one problem of how to prevent and how to really solve the problematic cases of drug misuse all over the world is about the stigma in it. And when we are confronted with severe stigma in mental health condition, such as drug use, the access to treatment is really difficult. That is number one factor that hinder an individual to seek support. That is why what we are doing today and what you are doing in your university is a great applause, and it is a really great endeavor, that we really help our students to really be aware of the stigma, and at the same time how to be an advocate in order for the other peers and other students to be aware of the risks that are involved in the drug use activity. And of course, these three, the early identification through behavioral indicators, the evidence-based referral protocols to psychological services or even medical services, and reducing the stigma to implement supportive and non-punitive responses can be integrated in a modular basis or in a syllabi. And this one is being highly recommended by UNESCO during 2023. Could be the best way in order for us to really develop a multi-tiered support system in terms of giving psychoeducation to our students. Now, to give you the summary, there is an emerging trend show rising stimulant, cannabis, and vaping misuse in students, and research underscores developmental vulnerability in academic pressures that leads to severe misuse of drugs. And again, psychoeducation is one of the strongest protective interventions and prevention in order for us to somehow minimize the problematic use of drugs, regardless of any kind of substances. And institutions, universities all over the world can really benefit from multi-tiered evidence-driven prevention systems. Okay, so these are my references, and I hope you gain some insight, you gain some additional information with regards to the practice that are being implemented here in my country, in the Philippines. But as I said a while ago, regardless of any country globally, we are facing a very problematic trend among the youth today, and that is the severe misuse of drug in our world. So thank you very much again for inviting me in this very important and relevant engagement today. And congratulations to your first International Youth Convention. Thank you, ladies and gentlemen.
Thank you so much, Dr. Jeny. And yes, your words were very insightful for us, and your work is really commendable. And thank you so much for your precious time, which you have spared for us today. And I believe that in future, we will also be collaborating with on some specific things which you have discussed. Thank you so much, Dr. Jeny.